Hello everybody. This is a video regarding the International Interdisciplinary Network on Smart, Healthy, Age-Friendly Environments, and it's a short preview to the D4 report on SHAFE policy, strategies and funding. I am Luiza Spiru. I'm a professor of geriatrics, gerontology and old age psychiatry, highly specialized in longevity medicine and gerontechnology. I'm the working group 4 leader of NET4Age-Friendly. What is the working group formation and objectives? There are very important objectives of this network. Existing policies, advocacy, and funding opportunities to be examined, to build out relations with policymakers and funding organizations, to synthesize and improve the existing knowledge and models to business models, to guarantee quality and education, the proper dissemination, and ensure the future of the action, to enable the capacity building, to improve the interdisciplinary participation, to promote the knowledge exchange, to foster across European interdisciplinary research capacity, the cooperation and the co-creation with cross-sectorial sectors, stakeholders, education for the students on SHAFE implementation and sustainability. But what is SHAFE? SHAFE is the short name representing the new concept which has been created since 2017 based on the desire to implement smart, healthy, age-friendly environments across Europe, fostering happier and healthier people in our communities. It is a wonderful concept. This idea took shape and became then a solid movement across Europe. It is smart, adaptable, and refers to the inclusive solutions and can support independent life throughout the course of life, regardless of age, gender, disabilities, cultural differences, and personal choices. SHAFE is a holistic approach that optimizes the social and physical environments, supported by digital tools and services, and it provides better health and social care, promoting not only independent living, but also equity and active participation in society. The community is in the physical, social, and cultural ecosystem closest to people. But this is not an easy concept to be put in practice. As a short history of SHAFE began as a thematic network approved by the European Commission to draw the policymakers, organizations, and citizens' attention to the need of better alignment between health, social care, built environment, and ICT, both in policy and funding, and delivered a joint statement of a framing paper in December 2018 to the European Commission and the member states. SHAFE evolved to a European stakeholder network which currently has over 170 partner organizations, and it is coordinated by Mrs. Carina Dantas and Mrs. Willeke van Stalduinen, Portugal and the Netherlands. SHAFE aims to achieve a better cooperation and implementation as the major challenges for the next period, as stated in the position paper released last year in 2020, with recommendations that aim to promote healthier environments for all the citizens and make these environments accessible, sustainable, and reachable for all with the support of technology. But from the early concepts, several projects have been implementing SHAFE in the field. But for sure, NET4Age-Friendly is the most recent proof of implementation. Where is SHAFE targeted to be implemented? First of all, on health and community services. In the area of health and community services, there are many needs, but I will mention just a few of them. The humanization of health services, in particular the increase of medical appointments duration, the better interaction between patient and professionals, the good adherence habits, and the more human and equipment resources. The new healthcare delivery concept that could prevent isolation and lack of access, namely those who are sustainable and high quality, to we would like to promote physical activity that can provide solutions for pandemic or emergency situation and to reduce the virus spreading to staff and other patients. To try to reinforce the workers and services in general, especially in the area of mental health in particular, and especially for children and the aging population. But integrations of SHAFE key elements in Bill's Healthcare's assets is very much person-centered life course approach of health promotion. And this is an important articulation between the primary and community care. The partners involved must be addressed for prevention for less treatment. Considering the palliative and long-term care, we should reduce the waiting list of these very fragile persons. This is the best good news during this year 2021, when the United Nations recognized as a good practice the principles of SHAFE. The United Nations launched an open call for good practice, success stories, and lessons learned by the stakeholders in the implementation of the Sustainable Development Goals for the 2030 Agenda. There were more than 700 submissions were reviewed by a team of experts from the United Nations entities, and SHAFE, implemented through NET4Age-Friendly, was one of the recognized good practices all over the world. This changes in a better way the way the way to implement and the access to implementations of the SHAFE principles in Europe, and not only in Europe. But SHAFE is going on be implemented during COVID, during the pandemic and post-pandemic. As you know, the current COVID-19 pandemic has been increased the risk for exclusion, poverty, inequalities, and the access to health, social care, and other public services. The direct effect of the pandemic over the older adults, which are in a high risk of developing severe complications with mortality rates increasing by almost 10% in patients between 70 to 80, and up to 15% in those age 18 and more and above. This is a problem. This is a major problem. It is a limited access to healthcare, the isolation measures that have reduced the availability of primary care and led to the post-moment of cancellation of interventions, and also the increased risk of decompensations of these patients with chronic diseases or comorbidities, as we call them, accelerates the increase in frailty and independent of COVID-19 infection. The same approach is reflected in the European policy and 21-27 strategy, the SHAFE vision for a healthier union, the response to improve the resilience of European health system. The support for the international cooperation through these 10 objectives, the most important 10 objectives, which focus on disease prevention and health promotion, preparedness for cross-border health threats, strengthen health data, and accelerate the digital transformation at the end. And the pillars of the European planning for 21-27 are focusing on the twin transitions, the green and digital, where the advances in robotics and smart techs are going to speed up the circular economy and implement the European Green Deal for recovery to social innovation. But facing pandemic, we are facing the ageism problem. The ageism problem has its indirect effects. The exacerbation of loneliness and social isolation, as I mentioned before, the loneliness or social isolation of the elderly, which has multiple negative effects. The pandemic triggered a parallel epidemic of ageism, and the media coverage describes that more and more those over 70 years of age are helpless, fragile, and unable to contribute to society, which is false. Prior to the COVID-19 pandemic worldwide, it had been proclaimed the loneliness and social isolation of the elderly that had become a global epidemic. This is problematic for several reasons. The older adults are an extremely heterogeneous group, and ageism leads to stereotyping. Age-related stereotypes influence the perception of older people about their own aging, having also a negative impact on their health. The ageism, in terms of the cost associated with healthcare, the aging, the continuous, the increased lifespan of aging population imposes significant economic cost on society, and this will accentuate the economic constraints caused by the pandemic. The impact of the elderly will vary worldwide, and these influencing factors will be different for those in low and middle income countries compared to those in developed countries. A recent global crisis, as we know today, is evolving rapidly, and very little is currently known as a wider impact on physical and mental health, especially on the older adults. But to realize SHAFE, there are some preliminary projects which are working on the realization of SHAFE, previous and ongoing, like hands-on SHAFE, educational game big, bridge the gap, design, create age-friendly housing, desire, the project desire. These are only a few of them, but speaking about the present and about the preliminary D4 report of the Working Group 4, SHAFE has midterm goals on the citizen's perspective, the environment perspective, health and care. The citizen perspective, to be digitally skilled, to be aware and understand the benefits and the challenges on the sharing of their data, to be engaged in the healthier lifestyle, to participate and engage in the democratic life, to maintain or improve as much as possible their social networks and relationships. Considering the environments, SHAFE tries to adapt the housing stock to foster accessibility and adapted public spaces and transport, to implement the climate neutral solutions to promote health and well-being in the workplace. Considering the health and care, it aims to promote reliable, safe and accessible big data, to implement the robust and interoperable digital infrastructure, to foster integrated, personalized, affordable and person-centered solution and new pathways. By 2020, the stakeholders network on SHAFE aims to achieve mainly coordination and implementation on SHAFE solutions, including this dealing with public health emergencies such a pandemic outbreak, specifically the following higher-level goals. Also, it aims to promote training of formal and informal caregivers on SHAFE, creating a toolkit and implementing training actions in multiple countries. And most of all, to raise awareness on the need to enhance prevention, social care building infrastructures, and environment condition in order to move the health and well-being provisions in the home and towards community and personalized prevention, to a health and well-being value-based approach through this cost action NET4Age-Friendly. Meanwhile, sustainable business cases will ensure companies and investors health and social cares to provide or implement SHAFE, especially regarding the building or restructuring the built environment, to include the ICT solutions, the digital solutions with integrated health and care provisions and safe human interrelations to foster future investment on smart healthy environments. But the most important of all, is to organize education and raise awareness of urban planners, architects, and ICT developers in general, to focus on people and places and focus research on lifelong learning, evidence-based design, smart, healthy environments, and empowerment, and social distancing with SHAFE and the other European main stakeholders. Speaking about conclusions and further notes, the business and further actions, the business modeling to identify the opportunities on SHAFE is very important. In the second year of the action, we pay very much attention to the capacity of building on business modeling in the field of SHAFE. We will start with webinars about the topic and organize training schools on this theme. The funding opportunities will be further sustained. The initial inventory of the partners' knowledge of funding opportunities will be further exploited in the second year of the action and the third one. We will organize webinars as well on the topic, and funding will become a most important part of the training school. I would like to close to the end in a very optimistic note, on a positive note, because SHAFE brings positive notes as regarding the European strategies for the elderly. The COVID-19 pandemic will give us the opportunity to assess our current approach and to identify the lessons learned during this period and to develop strategies and for sure new approaches to combat loneliness and social isolation among the elder adults. How to do that? By training, teaching social workers, health professionals, and the elderly to use new technologies, interactions with people in a non-traditional way, that can part of one of the practice of social and medical assistance. Also, we should consider the needs that will arise in the post-pandemia for our patients and their family who may experience increased depression, anxiety, and financial challenges, and finding innovative ways to address all these challenges, which will underpin the development of new policies in the field. But also to develop better tools for assessing loneliness and social isolation, because this is essential to have easily administrative tools and quicker to determine whether the older adults is single or socially isolated. We live in a new paradigm era, and the concept of interprofessional skills have infiltrated the health sciences and human services. The artificial barriers that have too often separated science into closed, stifling compartments, unnecessarily hindering innovation, have now become overcome. This development is partly stimulated by the application of technological innovations in computer science, informatics, engineering, and the like, to the requirements of the health and social service sector. But the notion of translational research has helped in this regard. The evidence-based practices are not a new idea, represent not a new idea, but a new empowering terminology is related to the reimbursement policies and decisions. And this is happening at a good time in terms of geron technology, as market forces encourage entrepreneurs to bring products to market and obviously benefit older users. This paradigm requires evidence of efficiency and effectiveness. Aging in place is one of my dearest concepts, which is also a main objective for SHAFE, is when assistive technology are embedded in a meaningful paradigm that encourages ease of use and interconnection with the specific goal of enhancing well-being and quality of life without the need of residential location. Last year, 2020, two pilots have been set up in the States, successfully set up for 30 and 23 end users. In the middle, as you see, there is the house of the home of the user, the individual home, which is entoured by a large circle where the most important stakeholders, the health professionals, the platform, the smart platform connected with the house, are trying to assure an aging in place concept and a medically home virtual hospital structure. And speaking about, because we're close to the end, in the same optimistic tone, I would like to share with you a very short movie on DigiWorld about how to catch Let's see it together.
Eu am murit odată, m-a socotit mult, 6 luni. Pentru ce trăiesc? Eu mă gândesc la moarte, dacă Dumnezeu nu vine să mă ia, ce se fac? Pentru ce trăiesc? Mă gândesc la moarte, dacă Dumnezeu nu vine să mă ia, ce se fac?
De ce oare nu ne ascultăm mai des bătrânii? Ne-am putea molipsi de vitalitatea lor. Într-o societate din ce în ce mai narcisistă și mai preocupată de tinerețea fizică, sfaturile lor cântăresc enorm. Sunt ca o întoarcere la izvoare, la lucrurile simple care contează cu adevărat. Lecție pe care specialiștii au învățat-o de mult.
Cred că este lecția capitală, este iubirea.
Nu există un lucru bine făcut care nu e dublat de iubire pentru ceea ce faci și dragoste pentru ceea ce faci, nu are aceeași valoare. Nu poți să faci lucruri care pentru alții sunt consumtive ca și energie dacă nu le iubești sau dacă nu le faci din suflet. Și nu ajunge doar iubirea, trebuie să ai talent, să muncești în egală măsură pe cât iubești. Dacă nu le iubești sau dacă nu le faci din suflet. Și nu ajunge doar iubirea, trebuie să ai talent, să muncești în egală măsură pe cât iubești. Viața e foarte scurtă. Am învățat lecția timpului, bucuria de a trăi, de a te bucura de fiecare moment din zi. Nici o zi nu se mai repetă. Timpul este cel mai mare capital pe care îl avem în viața noastră și dacă nu ne bucurăm sau nu facem, sau nu profităm de fiecare moment pe care îl avem, inclusiv în profesie, nu se mai întoarce. De fiecare șansă pe care o avem, dar în același timp răbdarea. Fără răbdare nu se întâmplă nimic bun.
Haideți să înrăzi Dumnezeu, ce mai din vreme, haideți, cred că sunt mai buni, mai trăiesc. Oriunde am fost, ne-am făcut datoria. În armată, în război, în serviciu, ne-am făcut datoria.
Oamenii de la țară care sunt longevi, se contopesc cu natura, au șansa de a se bucura de tot ceea ce natura poate oferi. Dar au și capacitatea emoțională de a se bucura. Pentru că, din punct de vedere cortical, probabil că în creierul lor există un echilibru la nivel de neurotransmisători în interpretarea noastră. Deci sunt oameni împliniți, sunt oameni înțelepți, care au luat ce a fost mai bun în viață sau ce n-a fost bun, au tratat așa cum se cuvine. Asta a fost să fie, am trecut peste asta, nu am încercat să mă distrug pentru că nu am înțeles ce mi s-a întâmplat. Pur și simplu au luat viața așa cum este, au trăit înțelept, nu au acuzat pe nimeni pentru ceea ce li s-a întâmplat. Nu știu să urască. Ura distruge. Ura este un defect care are un impact emoțional dezastruos pentru cortexul emoțional. Un om care e capabil să urască nu are cum să aibă un echilibru emoțional de calitate. Niciodată nu-l va avea. Întotdeauna va considera că cineva este vinovat pentru ceea ce îi se întâmplă. Niciodată nu va înțelege că în orice experiență de viață negativă este o lecție de viață personală. Nu va înțelege
Întotdeauna
niciodată
va considera
că
cineva
nu
este
se întâmplă
vinovat
nimic
pentru ceea ce se
întâmplător în
întâmplă.
viața aceasta.
Niciodată nu va
Nimic
înțelege că în
avem
orice
o
experiență de
misiune în
viață
viața
negativă
aceasta
este o
și
lecție de viață
dacă nu
personală.
înțelegem că orice rău
Nu va
este un
înțelege
pas
niciodată
înainte,
că
înseamnă că nu
nu se
înțelegem
întâmplă
lecția de
nimic
viață care ni se
întâmplător
întâmplă.
în viața aceasta. Nimic nu este întâmplător. Avem o misiune în viața aceasta și dacă nu înțelegem că orice rău este
Cum
un
să
pas
prinzi
înainte,
100.
înseamnă că nu înțelegem lecția
Sâmbătă
de
și
viață
duminică
aceasta.
la ora 20 pe DigiWorld. Cum să prinzi 100. Sâmbătă și duminică la ora 20 pe DigiWorld.
The VM grant. With the support of the VM grant, we have harmonized our work and built new mechanisms for further exploitation of the so far results. We have also contributed to activate our collaboration across 46 countries by employing two tools. The following tools are the NET4Age-Friendly Learning Repository and the NET4Age-Friendly Exploitation Booster. The Learning Repository. The Learning Repository is built based on our experience with guiding and developing the annexes of D4. See Annex 1. General objective: developing an online learning repository to exploit the outcomes from the mapping of the age-friendly country ecosystems. Cluster 1. It comprises the evidence-based strategies, programs, and platforms at national level. Cluster 2. It comprises evidence of a strong dialogue between science and technology, having as point of focus smart housing, centers of expertise, specific support tools, and others as such. Cluster 3 are mechanisms which increase social participation and inclusion of the older adult communities. Specific objectives. Specific objective number 1 is to build up a repository where relevant information on the ecosystem exists. And SO2 is the possibility to add more relevant research reports, studies, and analysis relevant to SHAFE and to organize it in a coherent manner. The NET4Age-Friendly Exploitation Booster is a mechanism to provide an overview of the age-friendly universe existent at the European level. For this support tool, we will help the 46 members of the NET4Age-Friendly to boost their initiatives for aging-friendly and to support qualitative networking and collaboration at European level and beyond. The NET4Age-Friendly Exploitation Booster is meant to connect the SHAFE learners who are advanced on the path of building age-friendly ecosystems and those who are at the start of the process. Hence, the Exploitation Booster bridges the gap between those who have the knowledge and expertise of developing strategies and implementing actions and those who do not have the same capacity in the specific fields. Their collaboration will be based on the learning repository and a series of online events which will ease the knowledge transfer. Specific objective is raising awareness and encouraging research on the topic by providing access to A. Our learning repository, B. Dissemination over the 46 countries, and C. Creating opportunities for partnership.
I hope that this was useful for all of us. It's a nice message. Thank you very much for watching this video. Thank you very much, Karina and Willeke, and all my MC members, partners, and colleagues from the Working Group 4. Without your support and your help, we couldn't do anything. And to all the network of Net4Age-Friendly, I wish you from all my heart to stay in health and to see each other in very good condition, face to face, if it's possible. My very best wishes and thoughts to all of you. Thank you.